Good morning, everyone. Today is Thursday, October 11th. Thank you so much for joining in to our weekly healthcare reform webinars. I am not sure if I'm having technical difficulties or not, but we'll get to that soon. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. My duties include overseeing the traditional group markets, small, medium, and large, the self-funded as well as reference-based pricing, and the new short-term limited duration products, as well as what I say is left of the individual markets in the Commonwealth of Pennsylvania. We've been running these webinars since August of 2013 on a weekly basis, and I'm glad that you all still find them helpful and that we're picking up new folks all the time. If you are new to our format, we encourage questions, and you can ask those in one of two ways. You can raise your electronic hand icon, which is in the control panel to the right of your screen, or you can type in your question in the question box, and I'll answer that at the end of the webinar. Again, questions are encouraged. So let's get right into the agenda, but before we do, if you could just, with a show of your hands, let me know if you can hear me okay and see my screen. Awesome, excellent, thank you all. I had some concerns this morning. Okay, let's get right into the agenda. We talked about the short-term limited duration medical insurance. As of 10/3, that can now be sold in the Commonwealth of Pennsylvania for 364 days. Previously, it was restricted to 89-day increments, and there are disclaimers. Our insurance department did put out quite a flyer on short-term limited duration versus ACA coverage, what's covered, what's not, and I think that they will be watching this pretty darn closely. So I, in capitals, just say be mindful of the disclaimers, whether you're writing in Pennsylvania or any other state. Some states have only adopted a 6-month plan. Some have not adopted any short-term medical, and some have kept the 89-day restriction. So if you have questions on that and in your particular state, just give me a call. Options for these products within URL: National General, single pay or a monthly option for up to 364 days. IHC does have a value standard and a plus plan. The plus plan offers up to $25,000 in pre-existing conditions covered per insured. So I think that's a neat way to look at these things. Backing up, National General does also have a guaranteed issue short-term medical. It, of course, does not cover pre-existing, but it is something in the event that we're outside open enrollment, your client doesn't want an ACA plan, and they have adverse health history. National General has a 1-year look back for pre-existing. IHC has a 5-year look back for pre-existing. So again, we'll move on, but any questions on the short-term limited duration, let me know. Open enrollment for individuals and families, it's right around the corner. It starts November 1st and runs through 12/15 this year, same as last. Training and the HCR.gov articles in my HCR newsletter. So Highmark has some training, some product training, and as well as the HCR.gov. So if you are in this segment or want to learn more, want to learn about what's new and exciting, and I say that tongue-in-cheek, then I would encourage you to look at my newsletter and log into HCR.gov and read those articles. They are, just as last year, having maintenance shut down on the marketplace every Sunday from 12 a.m. to 12 p.m., except for the last Sunday. One of the articles I read, it equates to 60 hours in the enrollment period that it will be shut down, but that's the maximum. They said that last year it was about 21.5 hours of shutdown maintenance time versus the scheduled 60 hours. So again, be mindful of that. Also, on the short-term limited duration, there is a hearing on October 26th, and there are 7 stakeholders that filed a motion in September to suspend the new rule because they said because it goes against the Affordable Care Act's mandate to cover essential health benefits and consumers who have pre-existing conditions. That's going to be heard again on the 26th. The record says if it is permitted to take effect, the short-term limited duration insurance rule will inflict serious harm on insurers and the health insurance marketplaces established by the ACA, making it much more expensive for anyone to purchase with all of the ACA protections and covering all the essential health benefits. That's what the complaint said. It's filed by Affiliated Plans, which is an association of insurers that provides the coverage on the marketplace. It includes National Alliance on Mental Illness, Mental Health America, American Psychiatric Association, AIDS United, National Partnership for Women and Families, and the Little Lobbyists, which represents families and children who have serious health issues. So that is who has filed for the injunction. I don't think that anybody really expects that it will be overturned, but it is something that we will be watching very closely. And I, of course, will keep you informed. Speaking of short-term, again, Phil Mishler, our Regional Sales Director for National General, we are having a webinar next Friday on the 19th at 10 a.m. This is a more in-depth webinar for anyone that wants to sell these products. Phil's going to go over the products in more detail, as well as quoting and, just more of the processes so that you have kind of a fuller understanding of the whole process or sales event. So hopefully you can join us. The invitation is in my newsletter that will be going out around 10 o'clock. Highmark Commission information, that's also in my newsletter. There have been increases in the Highmark individual commission block. Again, it is in my newsletter. There are 3 segments: Highmark Central, Highmark East, which is the former NEPA, Northeastern segment, and then Highmark West. So when you see those compensation schedules, this is the total comp, and it will be split 80-20 as per our contract. For instance, the EPO in Central PA is paying a total of $20 per member per month. That's split 80-20, so our agent partners will get $16 per member per month on new EPO business and will retain 4. So just be mindful of that so you're not disappointed, even more disappointed when those commission checks come in. Also for revenue, don't forget that URL and Colonial are offering that bonus for you. The flyer is attached. Hopefully, if you are writing group products, you have an opportunity for our reps, Dina and Brent McVicker, to go in and look at that group and really, again, do all that heavy lifting for you, secure that group. They don't compete with you. They don't write health. They're great partners, and it certainly only enhances your relationship with your group clients. This just in, CVS was approved to purchase Aetna from the Department of Justice with one condition, that Aetna would move their Part D to WellCare Health. And there's going to be a lot of other information coming in. We do have WellCare Health available through URL. The actual approval is supposed to take place towards the end of 2018, so clearly this will not affect anything that you do during your open enrollment period, which is starting on the 15th for your Medicare sales. But it is something you should be aware of, and we will certainly get you more information as that comes in. Also, the co-directors, Christy Wilbert and Karen McDaniel of the Medicare Offerings Department, will also have more information, and I'm certain that they'll provide that as well in their newsletter, the Medicare Connections. UPMC Fall Producer Kickoff, Friday, November 9th. That's at the Pittsburgh Marriott City Center, 7:30 to 11:30. They're going to discuss the 2019 individual and group plans. Certainly that will also come up, the expansion throughout the state into the new territories. So it is a trek for me, but I will be going over to learn more about 2019. And of course, I'll share all of that information with you once I get it. Attention Gemini Partners. You know, as I mentioned when I started this webinar this morning, that we've been running these since August of 2013, and that is more than 5 years by counting my fingers and toes. So we have decided to move to a new format for the healthcare reform webinars, and that's coming in January. And what will happen is, and more details will follow, but our weekly webinars are going to be reserved as a place where our Gemini partners can come and share sales ideas, product news, legislative news, and that's going to be a weekly offering. Our Aries valued partners, and we have a lot of them that are valued partners, will still have an opportunity to join in a monthly sales webinar. Going to have certainly legislative updates as well as new product opportunities and sales opportunities and ideas. So more information will be coming out. There's a lot of also other changes coming to the Gemini Partners program, some great enhancements. So for all of you Gemini partners out there, stay tuned for it, because I think you'll really be excited about some of the new offerings. And for those of you that are not Gemini partners or don't have any idea what our Gemini partner program is, I encourage you to reach out to me. I'm happy to discuss the program and see if you are a fit. So again, more information will be coming, but that is the direction we're moving. And that brings us to the end of our agenda today. So we're going to open it up for discussion. As always, I thank you for joining in. And while you're formulating your questions, just know that I'll be back here next Thursday, October 18th at 9:30, same time, same place, to hopefully have some more updates for you. So let's see if we have any questions. We absolutely have no questions, and maybe it's the rain making everybody sleepy, or maybe you just don't have questions, and that happens. But anyway, as always, I truly appreciate everyone joining in, and keep your questions coming. If you, again, don't know about our Gemini partner, ask me about it. Here's my contact information, 800-926-8875. I'm at extension 113. Or my email, deb@urlinsgroup.com. Thanks so much for joining in. I wish you all a great and wonderful balance of the week and an amazing weekend. Bye-bye.